Good morning. Thank you for joining us for this week's weekly Wednesday presentation from the Neighborhood Center. This presentation is being recorded and will be uploaded to the Otsego County Office for the Aging Facebook page and to our county website. I ask that anyone except the presenter and myself keep your videos turned off and that you remain muted unless you have a question. Please feel free to unmute yourself and ask questions as we move through this presentation. You can also use the chat feature if you prefer, and I will ask those questions for you. For those who are new to weekly Wednesday presentations, we host presentations every Wednesday using this same link at 11 a.m. Topics are on various community-based organizations and topics relevant to long-term services and supports. This was established in October of 2020 as a way to continue education on services and supports amid a global pandemic. For those who do not know me, my name is Alicia Chase. I'm Otsego County's long-term care coordinator. My role here at Office for the Aging is to supervise the New York Connects program, which provides information and assistance on all long-term services and supports available in Otsego County. Although my office is under Office for the Aging, we are unique in that we are able to help anyone of any age who is looking for help navigating the complicated long-term care systems. We can assist those who just want information and assistance, who need referrals to other community-based organizations such as social services, mental health, Catskill Center for Independence, Family Resource Network, just to name a few. People who need assistance with applications, and those who need help seeking information on admission to an adult home or a nursing home placement. If you are unsure if New York Connects can help you or your loved one or a client, please do not hesitate to reach out. We also have a New York Connects partner, Vince Baker, with the Independent Living Center in Oneonta. Those wishing to reach out to me can do so by calling Otsego County Office for the Aging at 607-547-4232. At this time, I'm going to turn the program over to Tina Shar with the Neighborhood Center for today's presentation.
Awesome, thank you.
You're welcome.
So our program helps post-adoption and post-guardianship families. So we are one of 15 centers that covers all of New York State. We cover 4 counties. Some programs cover 8 counties, but each one has at least 4 counties that they serve. So as Alicia said, our program is through the Neighborhood Center. So we're one of 28 programs within the Neighborhood Center. I know you guys are probably familiar with MCAT. That's part of our Neighborhood Center. I'm not sure what else is out in Otsego County through the Neighborhood Center, but I know that our agency has been reaching out to those areas. So we're currently in our 4th year of our 5-year grant. So we end in 2023. So our program is voluntary. So we don't require any insurance or anything like that. And we can work with other service providers because we're not a duplication of services. So we work with the entire family instead of just the adopted or the family that has the guardianship child. We work with the whole family. So SOHO stands for Schoharie, Otsego, Herkimer, and Oneida counties. So those are the counties that we serve. So as far as qualifications, you have to have at least one child in the family who's adopted or has guardianship. So currently we have 28 families in our program. It doesn't matter when the adoption occurred. I mean, it can be from birth all the way up to 21 years of age. So once a child turns 21, then we end up having to close that case. Right now, I think the oldest we have is 19 years old, I want to say. So initially what we do is we contact the family over the phone and arrange a home visit or someplace that the family would feel comfortable meeting. So the opening paperwork, I mean, we don't have that much. We just have identifying information. We do complete the ACEs assessment, and we do a service plan just to identify the needs and the goals of the family. So one of the main goals most of our families identify is meeting other families and building relationships in a support system. That's one of the big things. So the support group and family fun days are really popular as far as that goes. I mean, even more so now that things are opening up, because last year, the only thing we could really do was our online, which is a closed Facebook page. So we communicated through that way. And our care managers ended up dropping off supplies and things like that that the family needed. So we were able to do that. So how we get our families, so adoptions can occur through foster care, international, private adoptions, as well as kin gap families. So I don't know if you guys are familiar with the kin gap, but that stands for Kinship Guardianship Assistant Payment Program. So that's a long-term foster care placement with relative caregivers, and in some instances it can be a non-related caregiver that has established a relationship with the child. So individuals have to go through the foster care requirements in court in order to get the kin gap. Right now, I don't think we have any of that with our families. So the one main thing is guardianship versus custody, which has been a real issue. So guardianship, the plan is to keep the child with that family until they turn 18 years of age. So most of the time, families get guardianship, say if a parent were in prison for long term or if there was a death in the family. So custody is not till 18. Custody can be when a parent or somebody comes and files for custody. So we get quite a few referrals for custody. So we have to, find alternatives for that family. And I know Otsego County doesn't have a kinship program. So we typically refer them to the kinship navigator and try to help them out that way or set them up with some services so that they're not just left, not having anybody to connect with. So since we've been in our program for 4 years, we've only had one guardianship family. So family court typically just grants the custody because it's so much easier than the guardianship. So we're still looking for some families with that. I know when we initially started, we thought the custody was the guardianship. So our target numbers, needless to say, are way off because we had a lot of families targeted for that. So, but we do have 28 families through the adoption. We have a couple of international adoptions, but mainly ours are through the foster care system. So we have 3 care managers on staff who cover all 4 counties. So each care manager is assigned to a family and they meet a minimum of 1 time a month. And meeting can be, it doesn't have to be in the home. We like to go to the home, but if they feel more comfortable, I don't know, sometimes we've met at a McDonald's or Dunkin' Donuts or stuff like that, especially last year. We had, we figured out ways to meet up with them, Zoom meetings, stuff like that. But so typically what we do is we meet the family, we assess them for their needs, link them with resources in the community when necessary, provide referrals. So many of our families just utilize our care managers for support. So we also have, which is a big thing, is our non-recurring funds to assist unforeseen needs with the family. So we've done small car repairs, rent, mattresses. We provided payment for some transportation, school supplies, stuff like that. Last year we did computers. Some of the families didn't have that, so we could do our Zoom meetings and things like that. So that was a positive. Even we had purchased wood for one of our families, NICEAG bills, things like that. So we have funding for that. So our support group, so we just started doing our support groups again, holding them outside. So right now, Oneida and Herkimer counties are where we've had them, like the Frankfurt Marina and some town parks. So some of the families have met up with us for that are able to. Typically we've had them during the week, during the day. We've offered different times at night and things like that, but it doesn't seem to be a real big turnout. The main thing is the family fun days for families. So, but once school is out, the parents can bring the kids to the parks and we can do our groups that way. But we now have 5 families in Otsego County. So we'll be starting up a support group out there. I already mentioned the closed online Facebook group. So not just anybody can get on there. We have to approve them first. So now we're using the Facebook group mainly for support and communicating our events, providing educational material, and some parents interact on it. We do have to approve what's put on there, but there's a few families that do utilize it for different things. So our family fun days, which is the big thing. So the families like to get together. They built support systems. Through our 4 years so far, many of the families have been in the program at least 3 years that we've had. So So they develop relationships. They've had interactions outside of our groups and things like that. So typically what we do for our fun days, we paid for entrance fees, things like that. We brought lunch and games, so we provided those kinds of things. So our previous events have included like the Utica Zoo, Pumpkin Junction, the dinosaur train ride. I know that was in Otsego County. Polar Express we did a couple years ago. Bowling we've done, and snow tubing we ended up doing last year because that was an outside event. So this past Saturday, we actually went to Gilbert Lake State Park, and 4 of the Otsego families came to that. 9 families in total came, so we had 37 people, and a lot of them, we spent quite a bit of time there. So what we plan on doing here for the future is Glimmerglass State Park as well for the Otsego families. We'll probably be doing that in a couple weeks because the families really seem to enjoy that. We're planning an outside movie night here in Oneida County. I mean, if there's enough interest out there, we'll go out there. I think we're purchasing a screen, I think. We're planning the Utica Zoo, House Caverns we're doing the end of July, which we have 19 families so far that want to participate in that. So that's totaling 82 people. So that's going to be our big event for the summer. So families are looking forward to that. I think that's about it. But like I said, the main thing is support. And I know the families this past Saturday, like the Oneida County families meeting with the Otsego families, it's the first time that that's happened, you know, because of last year. So, but I think that's about it. But our actual office is located in Utica on 628 Mary Street. So as far as referrals, anybody can make a referral if they just call me, you know, or they can email me. If we get a referral from anybody other than the parent, we just, you know, we just need the name and the phone number. So we'll give them a call, talk about our program and see if they're interested. So we also work closely with DSS. We meet with them quarterly regarding referrals. We also do a lot of outreach in the community. We attend a lot of the events. I know we attended the event a couple years ago in Oneida that they had. So we're always looking for, you know, places to provide our information to and things like that. But it's a really great program. The parents seem to love it. So do the kids. They've made some friendships. Teen groups, we haven't started those up. We typically referred them to Project AIM, which is through the neighborhood center. Kids 12 and up were able to participate in that with other people within the community. So now that we have more families in Otsego County, and hopefully that'll be building, we can provide some programs out there. I guess that's about it. I know that was really fast.
Does anybody have any questions? When you mention support, is there an opportunity for one-on-one mental health counseling with children or caretakers?
We refer that out, so we don't provide the counseling. The main thing we do is the group. And again, with the Herkimer and Oneida County, we usually refer them to the neighborhood center because we do adults and kids, you know, unless the parent prefers someplace else. And a lot of times when we get the families, they're already set up with counseling through the different agencies. So. I'm sure I've forgotten something along the way. But a lot of our families have made the bond, and like I said, oh, do we have current flyers available? I do have a flyer I can attach to an email to you. So you can get that out. I do have flyers and yeah. Flyer as well as I have a document that just outlines all the services and stuff like that, separate from what the flyer doesn't. So. But a lot of our referrals, most of our referrals from Otsego County came from other families. DSS had reached out to one family, and that family pretty much contacted others within the community. So,
I know you said this is a post-adoption or guardianship process. Do you know who to connect with if someone is seeking guidance with these processes?
Do I know who to? do I know who to connect with? As far as like Dina Sams through DSS? Is that what you're referring to? Like I reach out to her.
If someone wanted help to get guardianship or adoption.
Oh, I see. Yeah, we can connect them with resources for that. I mean, we don't do that. We do go to court with people sometimes. I know initially our involvement is supposed to be right when they have the adoption certificate, but we've started working with families prior to that. So basically we can make contact. They can come to some of our functions, but they're not technically open with our services. So like the non-recurring funds and things like that, we're not able to do with them. We have a couple families now who are pending adoptions. And again, guardianship, I mean, that's hardly spoken of, you know, typically it's the custody. And especially now with the custody, with the legislation changing in 2019, saying that families who have the custody can now get medical attention for the child. I mean, that's changed. With guardianship, they could do the medical and the educational. So that was one of the benefits to guardianship. Well, custody seems to be the way to go.
Are there any other questions out there? All right, that appears to be all of the questions. And I did put Tina's contact in the chat. Oh, I think I didn't put it to all. Hold on one moment. I didn't share that with everyone. I'm just going to share this to everyone and then that will be all. There we go. All right. Well, thank you for joining us today. And if anyone has any questions, you can reach out to Tina directly.
Plan.
Thank you.
Thank you so much. Have a good one.